the worst thing I hear dentists say is, well, you're not gonna make any money. I could go out and make money. I'm like, if that's such a short-term goal, the money I'm making now was because I took the time throughout the years to invest into like better dentistry and high
Right.
quality dentistry. And this 1 year gap that you're going to get where you're not making the money. I mean, how much money are you really going to make as a first year associate at a DSO? And what kind of dentistry do you think you're going to be doing at that practice? You know?
Yep.
So if you are someone who is, you know, money, like is the driving force, this is, you're going to be comparing yourself to your other colleagues that are out there first year practicing. But if you're someone that just really wants like this to be a career that you take to the grave and not be burned out from it, and not, you know, just churning your wheels trying to see 100 patients a day to get there, then I've never I never saw the downside to residency. I just didn't. I never looked at my colleagues that were practicing my first year while I was on weekends at CE and said, gosh, I wish I was doing that. And said, I never did, because I really saw the value in like that program.
Yeah,
Um,
I think that's great
yeah.
advice.
And I think all programs, they're set differently, but you have, many dental students don't know this. You can go to these programs in the summers during your dental school years and ask them to shadow for a couple of days, see if this is something you'd want to do. You'll see very quickly that it might be a lot different than what you're learning in day-to-day dental school. And that might be what, it's almost like free CE in a way, because you're going to learn more complex cases and be guided throughout them rather than paying, you know, $20,000, $30,000 to go to an implant course. You get to do it in residency, you know, and have some hand holding. So I would tell them, if you're on the fence, shadow them in your summers or your weeks off. See if you can get into just programs to just a couple of days and see if it's something you'd want to do. And most dental students that do that, they end up saying, yeah, I kind of do want to do this. Like, you know, I saw some really cool things at that residency program that I'm not seeing, you know, at my dental school. So